Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Hi, my name is Laura Hernandez, and I want to welcome you to Gut Feeling. This is going to be your podcast about gut health. And why I am so passionate about gut health? Because I suffered from chronic constipation pretty much my whole life, and a lot of other symptoms related to chronic constipation. So, trying to find a solution, I started taking laxatives. For 19 years, it almost ruined my life. And when I found colonics, it changed my life forever. I never took a laxative again, ever. So that's why I want to introduce you through this podcast to colonics, to colon hydrotherapy, the benefits, the contraindications. But also, I like to bring a guest today, Dr. Jessica Arias Garau, who is an amazing physician, of course, but she's double board certified. And I'm going to tell you, her certifications is in physical medicine and rehabilitation, and she's an interventional pain medicine physician. So welcome, Dr. Jessica Arias.
Thank you, Laura, for having me here again.
Yes.
We need to finish our conversation that we had in our previous podcast, which was very interesting, and we still have a lot of more things to talk about and teach the public about our gut health, right?
Right. We need to be healthy from the inside out, and we forget about that. We do a lot of things in the body, but outside. Like we take care of our skin, we take care of our hair, but we forget about the insides. And colon health is super important. 90% of illness starts in the colon.
That's
right?
Exactly right.
And pretty much these days, a lot of people are having symptoms like bloating, constipation, like me, IBS, or the acid reflux. There's so many symptoms that could be that a person can be having, and they don't know where it come from. Sometimes people tell me here like, "Oh, but it started a week ago. I never had this," or I don't know, I never had skin issues or migraine, and suddenly they're having it and they feel bloated. And okay, so why? We're gonna find out slowly, because this is not a simple answer to all that, but slowly we're gonna get, the understanding, a better understanding of this with Dr. Jessica Arias.
Yeah, millions of Americans actually suffer from chronic constipation, as well as, like you said, reflux and bloating, myself included. I've been suffering for the same symptoms for many years as well. Stress, going through medical school, and again through my fellowship. There's a lot of stress involved and a lot of effort into like studying, etc. So you start feeling all these symptoms, and endoscopy after endoscopy. I probably have had like 4 endoscopies in my life.
I can relate.
And honestly, in my case, it wasn't that severe. I knew what I needed to do. I would take PPIs, I would take over-the-counter medications, and I've been able to manage that with my diet, etc. But colonics for me was something really new. I had no idea what colonic was until I met you, Laura.
I convinced you slowly.
You convinced me, and the reason why I came to you was because we were training for a marathon together.
Exactly.
And you mentioned maybe this will help you.
To feel lighter.
Hydration. To decrease all the bloating that you feel while you're running. And I was a little hesitant to try the therapy initially, but
I know.
But once I tried a couple of times, the first time, I think it's important to talk about how you feel while you're getting this colonics, because again, for me, it was something new to experience as a patient. I read about it, and I think it's an excellent alternative therapy for many patients, and we're going to be talking about the indications a little bit later. But experiencing as a patient was a little bit different, right? The first time I came here and I had the colonics, I felt like some abdominal discomfort, yes. And I'm like, okay, I feel uncomfortable. But you told me that as I continue to do my therapies, usually it's a series of two to three, right?
We'll get better.
Every time you'll get better and better and better, and that's how it actually happened. The first time, again, it was very uncomfortable, but I was not able to release as much feces as you should.
And it happens
And it
a
happens.
lot.
That's normal.
It's not about you. A lot of people are very dehydrated.
Right.
You train a lot, so that's one of the reasons. Some other people don't drink enough water, or you don't know. They have been like with the chronic constipation for a long time without doing anything, and that's the result. They don't release a lot during the first session, right?
Right. And then after you continue to have more sessions, you can see the difference, right? You start releasing more feces. And you mentioned to me, which was interesting to me, you said, be patient. You're gonna have the first session where, first maybe 10 minutes, you might release some fecal matter. And then you're going to have a period of time during the therapy where you might not see anything coming out. And you're like, okay, what's going on? Should I just stay here? But there's a second phase of,
right?
Again, releasing the fecal matter in the late, I guess, the last 10 minutes of the therapy. And as you do it more and more often, you can see an improvement throughout the therapy.
And everybody's different. Sometimes everybody's different and every session is different. Sometimes people are the whole session releasing. Sometimes they release at the beginning and some at the end. And it's like very difficult to predict what's going to happen. It depends on how's your body, if there's inflammation. For women, if we are on our menses, if we are stressed out, it all can determine the result, a different result during the session. So if we are too stressed, first brain, second brain, like I always said, connected by the vagus nerve. If you're too stressed, it's sending a signal, and the body, it's like in that state of alert, right? In the fight or flight mode, and you can't release if you are in that state. So I try to tell clients to breathe. And I teach them, and I make them do the breathing process during the first few minutes until they get relaxed and start releasing sometimes.
And one thing that I want to bring up, it's the difference in terms of the symptoms that you might feel before your colonics, during your colonics, and then after. Because the experience between patient to patient is very different.
Yes.
Again, most symptoms that are very common, again, the bloating, the abdominal pain, maybe feeling nauseous before you come in. While you're doing the therapy, I personally experienced hypersalivation.
That was very interesting.
And that was very interesting because you never heard of that before.
Yes, that was a new one.
But as we started talking about the symptoms that occurred during the therapy, you and I were talking about the autonomic nervous system, the sympathetic and parasympathetic nervous system, and how that plays a part in colonics. Right, so when we're stressed, when we are having all these symptoms, the abdominal discomfort, the reflux, you feel anxious, that's the sympathetic nervous system. That's an increase in the sympathetic activity of the nervous system. While you're doing the colonics, you're trying to trigger the parasympathetic nervous system, right? The rest and digest, because you're constipated. When you're in a fight or flight, you don't want to go to the bathroom, right?
Exactly.
So with the colonics, what is promoting is increased parasympathetic activity, so that you can do your rest and digest, and you can expulse all that fecal matter.
Beautiful.
So
it's
all
beautiful.
these symptoms that you're experiencing during the therapy have to do with that change from the increased sympathetic activity to an increase in a parasympathetic activity. So while you're having the colonics, you might experience vomiting, you might experience nausea. Some people might experience cramping. Others might experience goosebumps. I actually experienced that, and also the salivation, which is very common every time I have the colonics. But these are symptoms that are normal. And after you finish colonics, you can also experience different type of symptoms, like diarrhea, for example, or you might feel a little gassy at the end of the session, or maybe some abdominal discomfort. But these symptoms are short-term, and that's what I'm here for. I'm here to reinforce that colonics is an alternative therapy, is excellent for a certain type of patient. But these symptoms that you're going to experience, these changes are normal. They're short term, but the benefits that you're going to get out of this therapy in the long run is incredible.
I can talk about it. I
gonna
can go
be-
on and on and on with that. I've been 13 years doing colonics and also being a colon hydrotherapy. It pretty much has the same amount of time. Once I did it the first time, I knew I wanted to do this as a living, right? And every person, like we said, is different. Some people read a book while they're doing a colonic. Some people start watching a series.
I
or a
can't even
movie.
look at my phone.
I
Some
know.
people can't do anything.
And some people talk on the phone, which I can't do. And it's pretty interesting how everybody manages, right? Some people get nauseous, like you said. So that's why it's
Some
so
people feel
important.
really relaxed too.
Yes, that's why it's so important that people follow instructions. Like, for example, not eating anything 2 hours prior to the session. And if you have a slow digestion like me, 3 hours maybe or 4 without eating anything. After you can eat. That way the colonic it's smoother, it's more relaxed. You don't feel that uncomfortable feeling of the cramping or the nausea. So that's one of the instructions that we gave to the people that comes to do colonics. Most of them are constipated. Like chronic constipation is the most common thing that we see here. Some people want to detox the body and they use it that way, and they like do juicing or intermittent fasting or other things combining them with the colonics. So they will feel like they are detoxifying their bodies, right? Everybody has
And it
their
can also
thing.
help for weight loss too, right?
Yes, it helps in 2 ways. First, the obvious one. You lose some fecal matter, and that you will see it in your belly. Your belly starts going down. That's the obvious part.
You feel great after the therapy. You feel thin.
Yes.
That's why it actually helped
Light.
me, because I was when we were training for the marathon. I mean, it did feel like I was a lot lighter for the run.
Exactly.
So again, you can do it for many other reasons, right? But you can do it for weight loss.
But when you're constipated, the mood changes completely. Yeah. So you have mood changes. So I made a joke sometimes when I see somebody very angry, I said maybe that person needs a colonic, because every time I feel moody or anxious or like I don't feel myself, I do a colonic, and it brings me back to life. Like, okay, I feel hydrated, I feel clean, I feel light. It activates my parasympathetic nervous system, which allows me to function better.
It gives you a sense of well-being.
Yes,
It gives you a
that's
sense of
the awesome
well-being at
part.
the end. That's one of the long-term benefits, and it's incredible.
Yes, exactly. Also doing colon hydrotherapy, like the word says, hydrotherapy. So it's a therapy. It helps with the muscle tone of the colon. So it helps strengthen the walls of the colon. Of course, there are some contraindications. We can talk about it later. But I want you to tell me, Dr. Arias, how can people know if the issue they're having with the bloating, with the acid reflux, with the maybe diarrhea and then constipation, all those symptoms are very confusing sometimes, and you don't really know. Some people tell you, oh, this is that, or this is the other thing. It's like, okay, there could be a lot of conditions that could have those symptoms, but doesn't mean you have them. How can you know? How can you make the difference?
The symptoms are very similar between conditions, but the message that I want to bring across, it's very complicated. The medicine is very complicated, but if you experience any of these symptoms, you have to go to either your primary care physician, your gastroenterologist, or a physician that has the knowledge to determine whether or not this is an absolute medical condition that needs to be treated with medical treatments or interventional procedures. You have to undergo a certain type of imaging studies, maybe an endoscopy or colonoscopy, to rule out specifically conditions such as colon cancer, tumors, Crohn's disease, any diseases related to diabetes or thyroid problems that can slow down the gut motility. So your physician will help you determine if you have any of these conditions. Once we've ruled out all those conditions, then we can maybe consider alternative therapies. Like, again, you mentioned that you took over-the-counter medications. That's fine. There are many types of over-the-counter medications that you can take for constipation, but you have to be careful with which ones you choose, because some laxatives can promote, increase, or stimulate the gut too much, and then it happens what happened to you,
Exactly.
Laura.
That's what
then
happened.
it slows down the motility with abuse.
Exactly. And then you need to take more.
And you need more and more.
higher doses and stronger ones for
But
them
the
to work.
constipation gets worse.
Exactly.
So it doesn't mean you cannot take over-the-counter medications. You need to maybe consult with your physician to make sure that you're taking the correct one. And again, we prepare, I see, again, I'm not a gastroenterologist, but I do see a lot of patients with neurological disorders, stroke, MS, autonomic dysfunction, and problems of the nervous system that can affect the gut. And we prepare what's called a bowel program. So we combine certain medications to help you regulate your bowel movements. And again, once we've ruled out all those conditions that need to be treated in a medical way, then maybe we can say, okay, you can try colonics, because as an alternative treatment in combination maybe with over-the-counter medication or alone, it could be very, very beneficial, especially for patients that suffer from chronic constipation or IBS, for example, that's stress-related and not necessarily related to a particular pathological condition or an inflammatory condition.
Exactly. And we don't want to scare anybody here. Colonics are 100% safe if it's done with people that are licensed, certified, they know what they're doing, and they have the correct equipment approved by the FDA, like the ones we have. For example, we have what's called an open system, which gives you privacy, which gives you a lot of comfort during the session, but it's completely safe, okay? So in 13 years, more or less, I've been doing this. I never have a problem because it's done the right way. Pretty much the patients that arrive to our clinics, we have another one in Puerto Rico and the one in Florida, pretty much all of them have been into the GI doctor at one point or another, and they have been ruled out of any condition. And then it's like, okay, everything is okay, but I don't go to the bathroom. I don't have bowel movements. So the tests say everything is okay, but I'm not. Okay, good. So you don't have any of the conditions that are contraindicated, like maybe colon cancer, Crohn's disease, diverticulitis, the process in which you have the infection in the diverticula, okay? Because diverticula is very common. The
That's
problem
treated
is
with antibiotics. That's what I'm saying. So
exactly.
it's very important that you rule out those
Exactly. If you have an infection and if your doctor told you there's nothing wrong with you and you're still constipated and bloated, and sometimes people tell me, I changed the diet and I still don't go. I understand completely. I've been there, done that. So sometimes we change the diet and it's not going to work until we clean our colon, because there's a lot of accumulation already there for years. Stick to the walls of the colon, creating that buildup, the sensation of being full, the gas, the bloating. And that toxicity is not good, because if it's not going out of your body the right way, right, it's going to come out through another way. Sometimes in the skin, sometimes, like I said, with migraines, or sometimes people have back pain. And you said, what does it have to do with
I see many patients with back pain that have constipation.
Exactly, because it's pushing your kidneys. And in the case of women, they go to sometimes the gynecologist with pain, and they do an ultrasound, and it said, well, everything is fine, but you're full of poop. Let's put it that way. That's the way it is. And they call me like, oh my God, I don't have any problem. How embarrassing this is. No, it's not. Don't feel embarrassed about this. This is normal, and it's not only you.
And having gas and having a lot of fecal matter in your intestines can be very painful.
Yes.
Can be very, very painful.
Yes.
So again, it can be confused with acute
You feel
medical
you're dying.
problems.
You feel you're dying something. Oh my God.
No. So if you experience any of that, make sure you call your doctor and go right away, and make sure that you're diagnosed properly. It's really important. The other thing that I wanted to mention is that there are the lifestyle is very important. There's some factors that we can control to try to avoid constipation. Most of us have poor diets. We're not hydrating properly. Again, we're not eating as much fiber as we should in our diets, and we're not exercising.
It's true.
All those are risk factors for increased constipation. At least we can try to change that. And will definitely improve some of your abdominal pain, some of your symptoms. And again, combining it with hydrotherapy, it would be a very good result in the long run. But we do have that option. We have these factors that we can control.
Yes, there's a sedentary life these days. We don't walk
Watching
too
TV,
much.
playing games.
Exactly. We need to push it to get to the gym. We need to push hard to do, a walk, because this lifestyle is not designed for that. You go to Europe and people walk to go everywhere. Walk to work. They walk to home, and here it's not designed for that. So everybody has a car. We don't move much. So that's part of the problem. Another big and I think huge problem that we notice is that people want to use the toilet, but if they are at work
They don't.
or they are on a public place,
But they're stressed too, and they don't
They
want to stand up
won't.
from their desks to go to
No.
the bathroom.
so
and that's
they
not good
hold
either.
it. They hold it for hours. I don't even understand how, but they hold it for hours. But then when they want to go, it doesn't happen because there's a timing. You are saying to your body, your brain is telling your other brain, no, that's not okay. You're sending the wrong signal to your body. So then now I want, no, I don't feel like it now. That's what your other brain is telling you at that
You're
moment.
making a habit,
Exactly.
and we cannot make that habit.
Exactly. And one of the things that we suggest, sit on the toilet the same time every day.
Bowel program. That's
Exactly.
exactly what we do.
Exactly. And then sit at the same time. If it's 7 o'clock in the morning, if it's 8 o'clock in the morning, doesn't matter. Sit at the same time, but don't be there an hour. If you are there 10 minutes and nothing happens, 15 minutes and nothing happens, get up. Because that's another wrong signal you're sending to your body. If you're there 1 hour in the toilet sitting, doing nothing. No, you want to, it's supposed to be like a relaxed thing that when you go to the bathroom in the morning, you poop pretty fast and then you continue with your day and you feel great, right? I don't know your experience with that, but you can tell us, what do you think?
In terms of what you mean?
In terms of the habits of
No, it's
doing every day,
extremely
same
important.
time.
It's like the circadian rhythm when we sleep, right? So
Exactly.
if you don't make a habit of going to bed at a certain time and not eating 2 hours before you go to bed, your sleep is going to be interrupted.
Mm-hmm.
Same thing with the bowel. If you don't eat a certain time, or if you don't make a habit of taking your medication at a particular time, you're going to interrupt that gut brain connection. So the bowel program is actually designed for you to time your medication to help regulate your enteric system. So and again, hydration helps. The colonics will help if you also try to time your colonic therapy at a particular that time during the day or during the week.
Exactly.
It complements a medical bowel program
It's
with medication.
retraining of the bowels.
It's retraining of the bowel and the brain.
Yes,
That's,
exactly.
That's what it is. You're training the brain. You're training the nervous system to understand, okay, this is what I need to do, this activity, defecating. And your body works like that.
Another huge cause of chronic constipation, it's the lack of water intake. And some people tell me, I don't like water. I don't like the taste of it. It's like,
I'm guilty.
It doesn't taste. It doesn't have a taste. So sometimes I just try to help and say, well, maybe put some flavor on it. I don't like that idea, but maybe it's better than not taking anything. So I convince them to start taking water sometimes that way. But the water intake, it's everything. It's not only for your gut, it's your whole body needs it. Your
skin.
brain needs it to function. So we can't forget about that. Our bodies are water, right? The big percentage of water in our body, it's so important. We
And
recognize
colonics
it.
helps you hydrate too, because it's
Exactly.
basically extracting all that fluid and bringing into the gut. So in addition to your oral water intake, this will definitely help
Exactly.
for hydration. It will help for your skin. And again, with all the other
Of course,
long-term
but-
benefits that we've talked
Of course,
about.
but you're not going to do a colonic every day, so you need to drink
Right.
water too. So that's so important. And some people ask, but how much? Well, it's going to depend. Everybody's different. There's not a specific amount for everybody, so it depends on your weight. So you take your weight, let's say my weight, 120 pounds. So you divide it into 2, which is 60. That's the ounces of water you need to drink daily. Not sometimes, daily. And if you do it daily, your body starts also changing. And colonics, of course, is going to hydrate you. And I always tell a little bit of this kind of analogy. It's like when you leave something soaking in water from one day to the other or 2 days, it's going to soften everything up. So that's what colonics will do. You will release what your body is ready to release, and then the rest will keep soaking. And then when you come the next session, don't wait in more than a week between sessions. Everything will go smoother, easier, less crampy, less uncomfortable. So that's the idea of it.
And you recommend 3 to 5 sessions, usually the first time, and then after that for maintenance, usually about once a month, correct?
Exactly. So the length of the colon is between 5 and 6 feet long. So we recommend at least 5 sessions, as close as possible, one to the other. And then after that, everybody has a different lifestyle. So if you want to come once a month, some people take medications. They need to come once a week. Some people travel a lot. They get constipated when they travel, so they come before and after their trip. Everybody's different. You need to find what makes sense for your body. You need to listen to your body to understand, okay? So we can keep talking about this on and on, right? We can make a full series of podcasts
there's
about
a lot
this.
to talk about, but again, our message today was to make sure that you go to your physician, make sure you rule out all those absolute medical conditions, and before you consider trying colonics, which is again an excellent therapy, and it has many long-term benefits, and definitely recommend it.
So you can contact us in Florida. You can go to our website, truecolon.com. And we need to give a very, very special thanks to our sponsor, which is South Broward Accounting. And your CPA, Jorge Ruiz, he has a master in taxation. So you really want to talk to him. And his phone number is 954-318-7460, your one-stop solution for all your accounting needs. Thank you, Dr. Jessica Arias, for being with us.
Anytime.
See you
Thanks for
next
having
week,
me.
people.
Bye-bye.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.